Hello folks, in this video we are going to talk about how to perform a good assessment of a patient with a retinal condition. You can use information of this video for your retina clinics or even other clinics in ophthalmology. Before we get started, you have noticed this little orchid here. It's one of the type of the black orchid. It's called Epidendrum melanoporphyrum. I hope you enjoyed the information of this video and these little dark flowers. Let's get started. When you see a patient in retina clinics, like any other clinic in ophthalmology or medicine, you want to welcome the patient and make themselves comfortable in your office. After they are sitting comfortably, you want to start hearing the patient. Never ignore any symptom or complaint. Have open questions and hear everything they want to tell you. After you hear their initial complaints, you want to tell them that you're going to be specific and ask important questions for their problem. You want to ask about the past medical history, past ocular history, and family history. After you have all that information documented, you want to tell the patient that you're going to the next phase of the exam. You want to have a good eye exam. You position the patient, you perform all steps of an ophthalmology exam, and have a good dilated eye exam and retina mapping. You want to do the little drawings to make sure you document every retina finding. After you have this information, you may be able to build a broad differential diagnosis, and you can tell the patient you have some idea what's going on, but very often you want to need and order specific tests. The retina is a very delicate tissue and complex condition that require other tests like fundus image, fluorescein angiography, OCT, OCTA, among others. Have the patient undergo those tests, and when they return, you want to take your time to review carefully all the images. Once you're ready to talk to the patient, you want to call the patient and have another quiet conversation. Sometimes you may be ready to talk to the patient about a very likely diagnosis and a plan, but once in a while you may tell the patient that you have just 2 or 3 or a few differential diagnoses and you may need more time to review the case and have another appointment. Do not try to be a hero. Use as much time you need so you can have a safe and correct diagnosis. You want to show the patient the details and the results of the testings so they are confident that you're reviewing the case and being carefully. And they understand the condition, what's going on with their eyes and the retina. After you tell the patient the likely condition, you want to tell the patient what's the plan. That may include oral medications, eye drops, injections, or surgery. That's the time you want to stop and tell the patient that you're open to answer all their questions. I'd highly recommend that you involve as many relatives as you can, as long as the patient allows this procedure. I hope you like this little review of how I approach my retina patients and you enjoyed the little orchid. Good luck with your retina patients.